met her for what she's been through, but I have no idea if she'd have been treated any differently if she was white. How normal an experience is this for black people getting sectioned? Twice a week, I host a show on internet radio, and I want to ask my listeners what they think. We're going to be talking about black mental health, because I think it's something that's very, very, very slept on. We've got an amazing guest coming on the show today. He's a psychologist. Going to be talking to him, seeing, what he's seen in his 25 years in the mental health industry. Good morning, Malcolm.
Good morning.
Tell us a little bit about you and what you do.
At the moment, I manage mental health services. We look after around 450 people with severe and enduring mental illness.
Okay. We've got a caller on the line. Good morning, sir.
I'm actually a carer for my mum. Mum has been sectioned quite a few times. But it's always been something where the sectioning is, well, in my opinion, very unreasonable.
But were you given support to understand what was going on for your mum?
Not really. I don't know, the way the sectioning works, if, for example, if someone reports someone in, they'll section first and then they'll explain later.
That's not how the act is supposed to work. We must work with families. You're the people who are closest, you're the people who have the most information. I would encourage you to don't accept that. Demand that the family are more involved.
That's not something that's easy to talk about, so we're very, very grateful for your input.
Thank you.
Take care. As me and you, as black men, we are 17 times more likely to be diagnosed with a serious, mental condition.
When I look at the picture across Britain, it's poor man, it's pretty bad. You're much more likely to be diagnosed as suffering from schizophrenia. You're much less likely to get any talking treatment. You're much more likely to be held under compulsion of the Mental Health Act. You're going to be sectioned. You're going to be locked up. You'll get higher doses of medication. It's pretty rough.
Why is it that black people are being diagnosed? Why are we being put in that box?
Black people, when they go for help, are generally seen as more dangerous. So they're more likely to get a more severe diagnosis.
It's shocking to hear someone who works in mental health say we're seen as more dangerous, and it goes a long way to explaining the stats. But I do feel that sometimes as a community, we're too quick to blame everything on racism. Instead, do we need to look at our own behavior? Why is there such a stigma around mental health?